What is bleeding in early pregnancy? You may find yourself grappling with this question, especially if you are pregnant and have experienced this alarming symptom. Bleeding during early pregnancy is a topic that needs careful understanding and, thankfully, isn't always a sign of something serious. Bleeding in early pregnancy refers to any vaginal bleeding that occurs during the first 12 weeks of gestation. It's a fairly common occurrence, with about 1 in 4 women experiencing it to some degree. But what causes it? Several factors can lead to bleeding in early pregnancy. Implantation bleeding, which happens when the fertilized egg attaches itself to the lining of the uterus, is one such cause. This typically occurs about 10 to 14 days after conception and can be mistaken for a period. Ectopic pregnancies, where the egg implants outside the uterus, often in a fallopian tube, can also cause bleeding. This is a serious condition that requires immediate medical attention. Miscarriage is another cause of bleeding in early pregnancy. It's an unfortunate reality that up to 20% of known pregnancies end in miscarriage, often before the 20th week. Lastly, cervical changes during pregnancy can lead to bleeding. Increased blood flow to the cervix can cause bleeding after sexual intercourse or a pelvic exam. Now, onto the symptoms. Bleeding is the primary symptom, but it's essential to note that not all bleeding is a cause for concern. Light spotting, for instance, is usually harmless. However, if the bleeding is heavy, accompanied by severe abdominal pain, dizziness, fainting, or severe cramping, it's crucial to seek medical help immediately. So, what are the possible treatments for bleeding in early pregnancy? The treatment options largely depend on the cause of the bleeding. For instance, if the bleeding is due to a miscarriage, medical or surgical interventions might be necessary. In cases of ectopic pregnancy, surgery is typically required to remove the abnormal pregnancy. In less severe cases, like light spotting due to implantation or cervical changes, no treatment is necessary. However, it's always important to consult with a healthcare professional to ensure the health and safety of both mother and baby. In conclusion, bleeding in early pregnancy is a common occurrence with numerous potential causes. While it can be a sign of serious conditions like ectopic pregnancy or miscarriage, it can also be a harmless part of the early pregnancy process. Regardless of the cause, any bleeding during pregnancy should be reported to a healthcare professional to ensure the best possible care. Remember, it's always better to be safe than sorry. Stay aware, stay informed, and take good care of your health.